Dr. Mayank. I'm a board-certified plastic surgeon and a diplomat of American Board of Hair Restoration Surgery, catering to premium hair transplants in New Delhi for the past 12 years. Today we are going to discuss what exactly are the determining factors which would decide the success of your hair transplant procedure. So for your understanding, I have classified it into different headings. The first and the foremost is patient factors. Second, we would talk about are the surgeon factors. And third, what we'll discuss about is the clinic. All these things would be determinant upon what kind of results and expectations we can expect out of the procedure of hair transplant. Let's start with the patient factors first. Anyone who's at a stable age, which starts from 25 to 26 years of age, going till around 40-45 and even later for that matter, is basically belonging to a relatively stable age, but we have to be understanding that the utilization of medicines for further progression of baldness has to be maintained irrespective of where we are. The characteristics which will determine the kind of expectations that you may hold out of a hair transplant would be the kind of quality of the donor hair what you have. So if your donor is thick in density, apparently it may look very full, but when we just brush through it, what is the per square centimeter density of your hair follicles? What is the number of follicles per graft that you have in your donor? What is the kind of span that is available on your donor? Along with that, if you are undergoing a process of FUT, then the laxity of the skin, what exactly is the caliber of your hair? What is the texture of your hair? A person having relatively thicker hair with waves in the hair, that is wavy or curly hair, would always require lesser number of hair per square centimeter in comparison to someone who would have relatively thinner, straighter and silkier hair. So obviously your donor calibration is very important. Then we have to see what happens in the recipient area. So if your recipient area is huge, like a grade 5, 6, 7 at a very young age and stage, we have to look out for signs that your donor should not be having any kind of thinning coming in. So a proper evaluation is imperative. If you are just at the starting stage or age of your hair loss, then in that case, your reference points from where we start and where we might reach, which runs as the genetic pattern in your family, needs to be evaluated. All these points have to be seen and calculated when we are planning for your surgery, whether you are at 25, 26 years of age or at 40. So what we have to expect out of this procedure is something which would not give us natural densities, but an illusion that your head is full with hair. Apart from this, your medical fitness, and also it is important that you are not dependent or addicted to any things like nicotine or smoking or chronic drinking or on any supplementations which may kind of cause problems during your surgical intervention. So these points also need to be discussed transparently with your surgeon. Let's talk about the surgical points now. So what exactly are your surgeon's factors which are going to determine what would be the kind of result that we would be looking at? The first and foremost, what is the qualification of the surgeon? Whether he's a certified plastic surgeon or a dermatologist or a surgeon, or he is not even belonging to the fraternity of allopathic medicine. He could be a BHMS, BAMS, who are not the right people to go to. A dentist performing a hair transplant is not a person where you are supposed to go and get your procedure done. So your qualification is the first thing that you have to look. Second thing which calculates the kind of result that we would get out of a hair transplant is the kind of experience that a person would have. Now, anyone starting their journey may not be an experienced surgeon, but over a period of time, your skills improvise and the kind of results that you deliver along with your same team is something which would be much more fruitful in comparison to someone doing relatively new work. When we are looking at the surgeon's skills, is the surgeon performing all the steps which are supposed to be performed by the surgeon himself or not? So any incisional step that takes place on your scalp, that would be whether it is FUE extraction, excision of the follicles, taking the follicles out, your FUT if it is being performed, then is the strip being performed by the surgeon, the stitching to give you a fine scar, any recipient slits that are being created are being done by the surgeon or not. If any of these steps are being delegated to the technicians or another doctor or a junior person who's performing these steps, then it should be transparently discussed with you, and you should know that that could be a question mark to bring in the kind of results that you may want. The technicians are allowed only to place the follicles into pre-made slits. They are not supposed to perform any incisional steps on the scalp. So this becomes the point number 2. The third thing is that whether the surgeon is actually performing all different techniques of hair transplant or is restricted to only one type of surgery. If the surgeon himself is performing only one procedure, then the solution which is going to be given to you is not going to be a customized solution which you may be wanting or expecting out of a hair transplant. Apart from this, you also need to be knowing that your surgeon should be supervising the implantation also on frequent intervals, what is going to be done by the technicians. It's not that the process of incisions are done and then the surgeon is nowhere to be found in the operation theatre. Let's talk about the next point. Is the surgeon actually updating himself or herself with regular upgradation of the CMEs and conferences, or is reading the latest that is happening in the fraternity? So these are all critical points what you would see if you look at the academic interests of the surgeon also. Let's talk about the third point, which is the clinic factors. Now when you go to a clinic for a hair transplant, obviously you go to a dedicated center where the hair transplant is being performed. That could be performed by different category of surgeons or doctors who are available in that setup. You may go to a chain of clinics with one branch where you go and you meet a doctor who's a visiting surgeon who comes in and performs your procedure, and 1 year later or 5 months later there's another doctor for a follow-up. So always try to identify the kind of clinics which are being run by individual doctors and not chains of corporates who are running businesses out there. Apart from this, make it sure what points are going to be delegated by the clinic to the surgeon and whether the surgeon is going to be available for you for any kind of post-operative care or complication that might arise out of your surgery. You should have the access to talk to your surgeon and have regular follow-ups, whether telephonically, whether digitally or in person. But that is something which is going to be helpful for hand-holding you through the journey of your hair transplants. When you are looking at a clinic for hair transplant, please do not go for business lucrative deals that are given to you, like packages are sold and then obviously you are given unlimited follicles in an X amount of price and you feel very happy about it, that I'm going to do double the number of follicles than what the other surgeon had offered. But genuinely your donor area is something which is restricted, it is limited. So please do not waste your donor unnecessarily just because you got it in a deal. So you should always go in for an optimal coverage with a decent density and naturalness to your result. If all these factors are considered and you are walking that path, mostly you should get what is called as a good result or expected as a great result of a hair transplant. I hope these points make things clear to you. I would like to persuade each one of you to please do not calculate or jump to conclusions on the basis of what is being told to you online. Always consult a professional, experienced surgeon and then jump in for your surgery. I would like to thank you for sparing your time to view this video and would also request you to please like and subscribe to our channel so that you would get regular updates about all the videos that we are going to post in the near future. Thank you.